So the CANONIC study is unique because it is the first study which has been designed to define, I would say, agnostically the syndrome called acute-on-chronic liver failure, ACLF. And this study was designed to include a large number of patients non-electively admitted to European hospital for acutely decompensated cirrhosis, being defined as recent onset of ascites, hepatic encephalopathy, GI hemorrhage, or any combination of these. This is the unicity of the CANONIC study. There were a lot of striking findings, in fact. Not only we found that patients with ACLF, of course, had a high number of organ failure, high level of systemic inflammation, and high mortality, but also we found that this was a clinically distinct entity in terms of number and types of precipitants, and younger age of patients who develop this syndrome. Therefore, we clearly showed that ACLF is a distinct clinical entity among patients who are admitted for acutely decompensated cirrhosis. A very tough question, but I can provide some examples. For the first example is that the CANONIC cohort was used not only to define ACLF, but to also to look at the follow-up of the patients, and we showed that ACLF was an extremely dynamic syndrome. For example, 50% of patients with ACLF at presentation, ACLF1 at presentation improved. Approximately 40% of patients who presented with ACLF2 also improved, and even patients with ACLF3 who were potentially very severe at presentation actually improved in, I would say, 30% of cases, approximately, during the first week. Therefore, these findings clearly indicated that these patients should receive a very intense, massive treatment when they are admitted to the hospital, because we are sure that at least even for the patients who are very severe on admission, we will improve a substantial number of these patients. Therefore, this is the first lesson. The second lesson we got from CANONIC was, for example, regarding some treatments. The first example I have is regarding the use of terlipressin among patients with type 1 hepatorenal syndrome, and we showed that the response to terlipressin, the improvement of renal function, was extremely dependent on the level of ACLF, the grade of ACLF on admission. The higher the grade, the lower was the response to the treatment. Therefore, these findings raise the question of futility of treatment in some subset of patients, in particular ACLF3, and we have to refine this concept. Another example is related to severe alcoholic hepatitis, and these patients, of course, have a lot of these patients have ACLF when they present, and using the ACLF classification, we were able to show that the higher the grade of ACLF, the lower the response to the only medical treatment of acute, severe acute alcoholic hepatitis, I mean corticosteroid. Therefore, patients with ACLF3 have a very low response to corticosteroid. Therefore, the description of ACLF brought a lot of new information and also raised a lot of questions regarding, in particular, the futility of treatment, yes or no. When we analyze retrospectively the CANONIC cohort and looking at the outcome of patients who receive early liver transplantation, for example, early transplantation is a transplantation performed during the first 28 days after hospital admission. And when we looked at this very specific group, and we looked at patients who receive a liver transplant because they had ACLF2 or 3 on presentation, we were extremely surprised to see that the survival of this patient was excellent at 6 months and 1 year, as compared with the patient of similar severity who didn't receive a liver transplant. Therefore, this opened a new field, you know, and I would say a new hope for this patient, because until now, surgeons were extremely reluctant to transplant very severe patients. And these findings obtained in CANONIC have been confirmed in independent retrospective cohorts. And now the question is, which patients among ACLF2, 3 patients would not benefit from liver transplantation? So it's a criterion of futility, and this is why the ACLF CLIF designed a specific study to address this question, and this is a chance study which is ongoing now. It's an international study involving every continent: Europe, North America, South America, Asia, and we hope that with this study we will be able to refine the criteria for futile liver transplantation among patients with ACLF3. For sure, regarding the recent knowledge we got looking at patients with acutely decompensated cirrhosis, we had the feeling that probably in the next year we will give rise to precision medicine, to a la carte medicine for maybe individual patients or group of patients which have been more precisely assessed. For example, we performed in Latin America the equivalent of the CANONIC study. It is the ACLARA study, and in addition, we looked at the impact of genetic ancestry on the risk of developing ACLF, and we found that patients with Native American ancestry were at high risk of developing ACLF as compared with the patient with European ancestry or African ancestry, and therefore probably this means that Native Americans are a population of patients who require a specific follow-up, for example, and require specific measure to prevent the development of ACLF, and maybe also to prioritize these patients to liver transplantation when they develop a very severe form of decompensated cirrhosis. This is one example. And also we hope to develop tools to predict, the clinical course of acutely decompensated cirrhosis more precisely. This comes from the PREDICT study, which nicely showed that when patients are admitted to the hospital for acutely decompensated cirrhosis without ACLF, there are three very different trajectories for these patients, three independent trajectories, and currently we are not able to predict for a given patient which trajectory will follow in the next 3 months. And therefore this is a big challenge, and we are working actively, and I'm sure that we will develop tools to refine the prognosis, the assessment of prognosis in these patients, and we will so make a step forward to precise medicine in this field.